I have decided to present my fourth health education project on the subject of preventing gastroenteritis in children. This is a very relevant subject as gastroenteritis is common in children. So what is gastroenteritis? Gastroenteritis is commonly called the stomach flu. Influenza is commonly called the flu. To clarify, influenza is a respiratory condition. It causes respiratory side effects such as a cough, a sore throat, a runny nose, fatigue, and chills. Gastroenteritis affects the gastrointestinal system. It is often called the stomach flu, and it is a common illness, especially in children, that can lead to common GI symptoms such as nausea, vomiting, or diarrhea. The symptoms are essentially related to inflammation of the stomach and intestines. In America, the most common causes of enteritis are as follows. Causes of gastroenteritis may be of bacterial origin, they may be of viral origin, or they may be of parasitic origin. Depending on the origin, the treatments may vary. Bacterial gastroenteritis may be treated with antibiotics. The most common cause of gastroenteritis, especially in children, is the virus known as rotavirus. Namely, the biggest cause for gastroenteritis, regardless of the source of the infection, is cross-contamination, meaning children who go to public schools or are in public places around other children, particularly places where they may be playing together or using the same equipment. This leads to the spread of gastroenteritis. So how can we prevent gastroenteritis not only in children, but in anyone? The main thing is to wash our hands. And it is important to teach children not only to wash their hands, but how to wash their hands. They should know to wash their hands for at least 20 seconds. In children, it may help to encourage them to sing their ABCs or the happy birthday song to ensure they're washing their hands long enough, and of course are using soap and water. We also need to clean surfaces, especially common surfaces like tablets and doorknobs. We should use special food safety precautions, especially in a public setting. There is also an immunization that can help prevent the spread of the most common cause of gastroenteritis, which is rotavirus. So how do you know if your child has gastroenteritis? As mentioned earlier, the symptoms affect the gastrointestinal tract. Common symptoms can include stomach pain or cramping. The stomach may be swollen or inflamed, and if you are familiar with a stethoscope, you may hear increased bowel sounds. They may experience GI upset, such as vomiting, nausea, or diarrhea. A child may experience a poor appetite, and it may be difficult to get them to eat. A child may also have a fever, which can actually lead to them feeling cold and chilled. And a child may also be irritable or fussy, particularly in infants who can also be affected by gastroenteritis. There are more serious symptoms. It is important to note the serious symptoms of gastroenteritis, as if any of these symptoms are noted, it is probably best to take your child to the doctor. A fever of 102 degrees Fahrenheit or higher is an indication to take your child to the doctor, or at least speak to your physician. If your child is extremely lethargic or irritable, if they have extreme abdominal pain or swelling. Make note of bloody or green vomit, green in the sense that it may be stained with bile. Note any bloody diarrhea. It is very important to note signs of dehydration, especially if your child has a poor appetite and is experiencing poor intake. These symptoms may include dry skin or dark-colored urine. If you have recently been to an area with poor sanitation, it is important to make note of that as well. As we mentioned earlier, the rotavirus is the most common cause of gastroenteritis in children. A very good way of preventing this is actually through an effective rotavirus vaccine. This vaccine is actually given orally in an oral drop method. Since 2013, babies have been offered the rotavirus vaccine. The oral drops can actually be given at 2 and 3 months of age, but if it is not given during infancy, discuss this with your provider, as it can still be administered in early childhood and may protect your child before they go to public school. So what are potential complications after or during a gastroenteritis infection? Serious complications may include electrolyte imbalances. This is a side effect of dehydration. Electrolyte imbalances can lead to hospitalizations, so it may be a good idea to provide your child with Pedialyte or sports drinks such as Powerade or Gatorade. An infection of the GI tract can lead to secondary infections if not treated, which can also subsequently lead to hospitalizations. It is not uncommon for gastroenteritis in children to lead to lactose intolerance, which may resolve over time. It's also not uncommon for the child to experience irritable bowel syndrome, and also malnutrition coinciding with a poor appetite may be a factor. For additional information about how to prevent gastroenteritis in our children, particularly children who go to public schools or interact with children outside of their own family on a regular basis, please see the additional sources. I am presenting my 4th health education project on preventing gastroenteritis in